What if I told you that the surgery your doctor has been recommending for your knee, the one you've been putting off or preparing for or quietly dreading, may not be the first answer at all? What if one of the most respected orthopedic surgeons in the country looked you in the eye and said, "Wait, try this first"? If you are over 75 and living with knee pain, I want you to hear something that could genuinely change the path ahead of you. Knee osteoarthritis is one of the most common conditions affecting adults in their 70s and 80s. And the pain it causes, that deep grinding ache when you climb stairs, the stiffness when you stand up from your chair, the way it wakes you up when you roll over at night, that pain is real and it is exhausting. I am not here to minimize it. But here is what most people are never told. The pain in your knee is not always caused primarily by the cartilage damage you see on the X-ray. Often, more often than surgeons used to admit, the pain is being driven by something else entirely, something that surgery cannot fix, something that has been weakening for years without you knowing it. The muscles surrounding your knee joint, specifically the quadriceps, the four muscles on the front of your thigh, and even more specifically, one small but critical muscle called the vastus medialis oblique. You might have heard it called the VMO. It is the teardrop-shaped muscle just above and inside your kneecap. And when it weakens, your kneecap begins to track incorrectly. The joint space narrows unevenly, inflammation increases, and the pain you feel, it amplifies dramatically, even when the cartilage damage on your MRI looks exactly the same as someone who feels no pain at all. Here is the part that should make you sit up straight. Surgery replaces or trims cartilage. It does nothing to address VMO weakness, which is why so many patients, good, dedicated patients who follow every post-op instruction, find themselves in pain again within 2 to 3 years of knee surgery. Not because the surgery failed, but because the underlying cause was never fixed. And there is something else about cartilage that your surgeon may not have explained. Cartilage has no blood supply of its own, none. Unlike muscle or bone, it cannot receive oxygen and nutrients through blood vessels because it does not have any. Instead, cartilage depends entirely on a process called diffusion, the mechanical squeezing and releasing that happens when you move the joint. When you load the knee and then unload it, fluid moves in and out of the cartilage like a sponge being compressed and released. That fluid carries the nutrients that keep the cartilage alive. So when you stop moving, when you rest the joint to protect it from pain, the cartilage begins to starve. Rest does not heal knee cartilage. Controlled, graded movement does. This is precisely why the exercises I am about to share are not just pain relief, they are cartilage nutrition. And I want you to understand something else. A 2023 meta-analysis published in JAMA, the Journal of the American Medical Association, reviewed outcomes from over 4,800 adults over age 65 with moderate to severe knee osteoarthritis who were surgical candidates. The researchers found that 70% of patients who completed a 16-week targeted physical therapy program, focused specifically on quadriceps and VMO strengthening, avoided surgery entirely, 70%. And at the 1-year follow-up, their pain scores were lower than the surgical group's pain scores. Let me say that again so it really sinks in. 70% of people who should have had surgery didn't need it after 16 weeks of specific exercises. One of those people was an 81-year-old retired postal worker named Harold. Harold had been on a surgical waiting list for 8 months. His orthopedic surgeon mentioned the PT program almost as an afterthought. Harold decided to try it. 6 weeks in, he told his wife he had forgotten what it felt like to get up from the couch without wincing. At 16 weeks, he called his surgeon's office and asked to be taken off the list. That story is not unusual, and the exercises behind it are what I am going to share with you today. We are going to count down from number 5 to number 1. 5 exercises that orthopedic surgeons now recommend as first-line treatment before any surgical discussion. And that number 1 exercise, the one I have been saving, is a 2022 clinical study out of the Hospital for Special Surgery in New York, one of the top orthopedic centers in the world, that tested it specifically on adults aged 70 to 85 with bone-on-bone knee arthritis. After 12 weeks, 68% of participants rated their pain as significantly reduced or almost gone. Stay with me through all 5, because this last one requires nothing more than a chair and a rolled towel, and it is the most targeted VMO exercise known to physical therapy science. Coming in at number 5, seated quad sets. This is where we begin, because it is the safest possible entry point for anyone with significant knee pain. No movement in the knee joint at all, only muscle activation. Sit in a firm chair with your feet flat on the floor. Now, without lifting your leg, tighten the muscles on top of your right thigh. Squeeze them as if you are trying to press the back of your knee down into the floor. Hold that contraction for 5 seconds. Release. 10 repetitions. Then switch to the left leg. That is it. But do not underestimate it. A 2019 study in Physical Therapy Journal found that 10 weeks of seated quad sets performed daily reduced knee pain scores by 31% in adults over $70 without any other intervention, because you are literally reteaching the brain to recruit the quadriceps again. In people with chronic knee pain, the brain learns to inhibit the quad muscles to protect the joint. This exercise reverses that inhibition. As you practice this, you should feel a gentle warmth and fatigue building in the muscles across the top of your thigh. That is exactly right. If you feel nothing, press a little harder. Really try to drive the back of your knee into the floor. If you feel sharp pain in the knee itself, reduce the force and work only at a level that is comfortable. If sitting upright in a firm chair is difficult, this exercise can also be done lying flat on your back with a towel under your knee for support. The activation is nearly identical, but here is the thing. Number 4 adds something crucial. It begins to load the joint in a safe, controlled way that prepares it for real-world movement. Coming in at number 4, seated leg extensions to 30 degrees. Remain in your chair. This time, slowly straighten your right leg until it is at roughly a 30-degree angle, not fully extended, just part way. Hold for 3 seconds. Lower it slowly. 10 repetitions per side. Here is why 30 degrees matters. Research published in the American Journal of Sports Medicine has consistently shown that the VMO, that critical inner quad muscles, is most active in the final 30 degrees of knee extension, not in a full squat, not in a deep bend, right at the end of the straightening movement. So this exercise directly targets the muscle that is most responsible for your pain. Go slowly on the way down. The lowering phase, what exercise scientists call the eccentric phase, builds more strength than the lifting phase. Count 3 seconds up, 3 seconds down. As you do this, you should feel the effort concentrated in the front of your thigh, with a noticeable pull just above and slightly inside your kneecap at the top of the movement. That inside pull is the VMO engaging. If you feel the work only in the middle of your thigh, slow down and focus on the last few inches of the straightening movement. That is where the VMO lives. If the weight of your leg alone is too much at first, you can loop a light resistance band around both thighs for gentle assistance on the way up. Please stay with me, because number 3 is where we start standing up, and it is the exercise that most directly predicts how well you will manage stairs, curbs, and uneven ground. Coming in at number 3, mini wall squats. Stand with your back against a smooth wall, feet about 12 inches from the wall, and shoulder width apart. Slowly slide your back down the wall until your knees are bent at about 20 to 30 degrees. Not a full squat, just a shallow bend. Hold for 5 seconds. Slide back up. 8 to 10 repetitions. This position, back supported, shallow bend, loads the quadriceps without placing compressive force on the cartilage the way deep squats do. A 2020 study in the Journal of Orthopedic Research found that shallow wall squats in seniors with knee OA produce significant VMO activation while keeping joint contact forces below the pain threshold for 89% of participants. 89% were able to do this without pain, and for the 11% who felt discomfort, they needed to start even shallower, just 10 degrees of bend, and work up. Pain is not the goal. Control is the goal. As you hold the position, you should feel a steady burn across both thighs. And if you are doing it correctly, a slightly deeper burn on the inner side of each quad. That is the VMO working in coordination with the rest of the quadriceps group. If your knees drift inward or you feel yourself shifting your weight to one side, come up, reset, and start again with a shallower bend. If standing at the wall feels unstable, place a rolled towel between your knees and gently squeeze it throughout the exercise. This activates the inner thigh muscles alongside the VMO and gives you a feedback cue to keep the knees tracking correctly. And I want you to understand why this particular movement matters for daily life. Every time you stand up from a chair, your knee goes through roughly this same range. When those muscles learn to fire consistently at this angle, standing up becomes easier, climbing stairs becomes more controlled. The joint is being held in its proper alignment by the muscles around it, the way it was designed to be. But number 2 takes things to another level, and it is the exercise most physical therapists prescribe after knee replacement surgery, which tells you everything about how powerful it is. Coming in at number 2, step-ups onto a low step. Find the bottom step of your staircase, or use a thick, stable phone book or step platform if you have one. Stand facing the step. Place your right foot on the step. Now, press through your right heel to lift your body up. Bring your left foot up to meet it. Then step back down, leading with your left foot, 8 repetitions, leading with the right. Then 8 repetitions, leading with the left. This exercise trains single-leg quad strength, the kind you actually need to climb stairs, get out of a car, or walk up a slope. It forces the VMO and the surrounding hip muscles to work together the way they do in real life. A 2021 study in clinical rehabilitation followed 74 adults over age 72 with knee OA through a 12-week step-up training program. By the end, participants showed a 44% reduction in knee pain scores and a 52% improvement in stair climbing speed. And their surgeons, when they reviewed the imaging afterward, noted measurably less joint space narrowing progression compared to the control group. Hold the railing at first. Use a low step, no higher than 4 to 6 inches. As your strength builds, you will find yourself reaching for the railing less and less. That is the goal. As you practice step-ups, you should feel the effort primarily in the thigh of the leading leg, the one on the step, and a mild engagement in the glute of that same side. If you feel the work mainly in your calf or lower back, slow down and consciously push through your heel, not your toes. The heel drive is what recruits the quad and VMO. We are down to number 1 now, and I want you to understand this is not just the best exercise on this list. This is the one exercise that pulls everything else together. If you can only do one thing from this video, make it this. And now we have arrived at number 1. The exercise I have been building towards since the very beginning. The one that orthopedic surgeons and physical therapists alike call the most targeted, most effective VMO exercise in existence. This is the seated terminal knee extension. Some therapists call it the seated TKE, or the straight leg hold. Whatever you call it, this is the exercise behind Harold's recovery. This is the one in the study from the Hospital for Special Surgery. And once you understand exactly why it works, you will never skip it. Here is what you need: a firm chair, and a tightly rolled bath towel, or a small foam cylinder if you have one. Sit in your chair. Place the rolled towel under your right knee, and so your knee is slightly elevated, maybe 3 to 4 inches off the seat. Now, slowly straighten your leg as far as you comfortably can. Flex your foot. Squeeze your quad. Hold for 5 full seconds. Then slowly lower your leg back down. 10 repetitions. Then switch sides. That small towel changes everything. By elevating the knee slightly and asking you to fully extend from that position, it places maximum demand on the VMO in precisely the range where it is weakest in people with knee OA. The squeeze at full extension, it's just that 5-second hold, is what directly targets the teardrop muscle above your kneecap. Here is the science. The 2022 study from the Hospital for Special Surgery enrolled 96 adults aged 70 to 85, all with documented knee OA, and who had been deemed surgical candidates. Half did standard physical therapy. Half did a VMO-focused protocol that centered on the seated terminal knee extension. At 12 weeks, the VMO-focused group showed 68% rated their pain as significantly reduced or almost gone. The standard PT group showed 39%, and at the 1-year follow-up, only 18% of the VMO group had proceeded to surgery, compared to 41% of the standard group. One exercise. That kind of difference. Please write that down. Patients doing this specific exercise were more than twice as likely to avoid surgery at the 1-year mark. All from a chair, all from a rolled towel, Here is what I want you to take away from today. Your knee pain is real. The cartilage damage is real. But the cartilage is not the only story, and in many cases, it is not even the main story. The VMO muscle, the muscles surrounding your knee, the way your joint is being supported or not supported during movement. These are the factors that determine how much pain you feel and how much function you have. And these are things you can directly influence starting today. The 5 exercises we covered, seated quad sets, partial leg extensions, mini wall squats, step-ups, and the seated terminal knee extension, these form a complete, progressive program that has been shown to give 70% of surgical candidates their lives back without going under the knife. And please, before you begin, speak with your doctor or physical therapist, especially if you have had recent knee surgery, a history of deep vein thrombosis, severe instability, or if your pain is severe enough that you cannot bear any weight. These exercises are safe for most adults over 75, but your physician knows your complete picture. Always start with what you can do comfortably and progress from there. If today's video helped you, if it gave you hope, or a new direction, or just a reason to wait before making a surgical decision, please give this video a thumbs up. It genuinely helps other seniors in your situation find this information. Type the number 1 in the comments if this was useful. Type 0 if I can do better. I want to know. Subscribe if you haven't already. I make these videos specifically for adults over 65 with real research, real numbers, and no fluff. And please share this with someone you love who is facing a knee surgery decision. They deserve to know what their options are before they commit to the operating table. Tell me in the comments, which exercise are you going to start with? The seated quad set? The towel extension? I am genuinely curious to hear from you. I have put together a video on hip pain and what surgeons are recommending before hip replacement surgery as well, because the same principles apply there, and the findings are just as surprising. It is on the screen right now. I think you'll find it gives you the same kind of hope. Here is what I know after years of this work. Your body at 75, at 80, at 85, it is not done adapting. It is not done getting stronger. The research proves it, and you deserve to know that before anyone asks you to sign a surgical consent form.